Hello guys, this is Mujib once again, and today we are going to talk about PID. Yes, we are going to talk about PID, pelvic inflammatory disease. Yes, I know some of you have ever heard of it. So, PID is an infection that affects the female reproductive organs, including the uterus, fallopian tubes, and ovaries. So, in this infection, there is inflammation of all those organs of the female reproductive system. Yeah. So, what are the causes of PID, pelvic inflammatory disease? So, the major cause of PID is sexually transmitted infections such as chlamydia and gonorrhea. So, the bacteria, so how they come about here? So, like the bacteria travels from the vagina to the cervix and then to the uterus and then to the fallopian tubes. That's how it comes about here. So, symptoms. What are the symptoms that you have pelvic inflammatory disease? When you have lower abdominal or pelvic pain, when you have unusual vaginal discharge. Yes, it can be yellow, green, or smelly. That's one of the signs that you have pelvic inflammatory disease. When you have pain during sex, that's one of the signs that you have pelvic inflammatory disease. When you have bleeding between periods or after sex, yeah, that's one of the symptoms that you have pelvic inflammatory disease. So when you have fever and when you have painful urination, yeah. So what are the complications of untreated pelvic inflammatory disease? Yeah? So if left untreated, yeah, pelvic inflammatory disease can lead to serious complications. Yeah, it can lead to serious complications. Had to repeat it again. So the first one is infertility. So you can get some infertility when you have pelvic inflammatory disease. So the second one is ectopic pregnancy. So if you don't ectopic pregnancy, this is pregnancy outside the uterus. So the third one is chronic pelvic pain. You remain with chronic pelvic pain. So how do we prevent pelvic inflammatory disease? So regular STI testing. So you people, you should go for some regular STI testing. Like those people are very active, yeah. You should sometime go for pelvic. You should sometime go for STI testing. Yeah, you can go. They test you whether you have gonorrhea, whether you have chlamydia. So there's some people who are sexually active, yeah. So safe sex practices like using condoms, yeah, you should use condoms. So condoms prevent like those STIs, yeah, which can lead to pelvic inflammatory disease. Also, you should have prompt treatment of STIs, yeah. Some of you be there when you have STIs and you don't get treatment, yeah, so you end up getting pelvic inflammatory disease. So I remain Mujib. So for any questions, you can send me. Thank you very much for following me up. Yeah, thank you very much. I remain Mujib. Stay safe.